Dr. Melanie Hollidge is one of our trauma anesthesiologists. She is a phenomenal trauma anesthesia provider and a critical care physician. She went down to North Carolina for some vacation.
I was down in Garysburg, North Carolina, April 28th, and I bought a bike specifically to go on the track, and this was my first time riding it. The last stop was on the front straightaway. I went ahead and I probably got up to 80 or 90 miles an hour and then was gearing down and approaching the instructor. Had just started to apply the brake. There was a little wobble in the brake and I kind of let go, and the next thing I know, the front brake locked up out of nowhere. I remember as I was going through the air, I was thinking, you need to get a hold of Dr. Scalea.
My name is Dr. Thomas Scalea. I am the Physician-in-Chief at the R. Adams Cowley Shock Trauma Center, University of Maryland. I am the Francis X. Kelly Distinguished Professor of Trauma at the medical school.
He's affectionately known as the boss, and he's very protective of his folks.
I got a call, and it was Melanie Hollidge. She had been significantly injured.
I had broken left leg, multiple rib fractures, almost all of them on the right-hand side, blood and air in my right lung. I dislocated my sternoclavicular joint. I tore the oblique muscle off of its insertion point on my pelvis. I had extensive hematoma from below my rib cage all the way down to about mid-thigh, and sprained my left ankle, broke my baby finger, had some bruising of my hand, and some, obviously, lung contusions.
You know, she was getting airlifted to Duke. It's a very reputable shop, and I told her that we would be in touch and we would get her home just as soon as we possibly could.
Baltimore shock trauma is known to be the ultimate place where one would want to be if they had experienced a trauma.
How do we get from North Carolina back home?
I knew from my prior experience that all you need to do is make one phone call to Isaac Leader in VitalOne and we can get this job done.
Ultimately, Dr. Samet suggested VitalOne, and Isaac reached out and said that they would be pleased to help me get home.
And it wasn't a question of if, it was a question of when.
This was a particularly special transport because the patient was a physician herself, and not just any physician.
I've worked on choppers as both a nurse and a doc. I also am part of the GO team. The GO team is a very unique thing to the Shock Trauma Center. It is a mobile addition to EMS that goes to the scene to provide additional procedures in the field, specifically things like emergent limb amputation, chest tubes, REBOA, splinting, basically critical life-saving procedures in order to get them extricated and stabilized for transfer. The state troopers have helicopter bases at 7 different places around the state, which allows rapid deployment of the GO team anywhere in the area.
Not only are we transporting a critical patient that was involved in a motorcycle accident, she's also a critical anesthesiologist in the hospital, and she's very well versed with all the treatments that we are going to give her during a flight.
Given that the patient had a chest tube, the flight plan was created to fly at sea level in order to minimize any risk of the patient deteriorating during transport.
Based on the patient's condition, try to stay at a lower altitude so it reduces complications for the medics and the patient in the back.
We went through step by step so that she's comfortable with our care, and she felt extremely comfortable with everything we did today.
I remember, for me, with rib fractures that were still not plated, and I had an epidural running. So I was still having a fair amount of discomfort, particularly with moving from a bed to a stretcher or from a bed to a CT table. When I got moved from the bed onto the stretcher was how gentle and careful the team was about getting me situated.
I measure professionalism in terms of ease. Highly professional, highly competent organizations, everything just works. This transport by VitalOne checked all of those boxes. It was highly professional from start to finish. If this wasn't the easiest air transport we've ever done, it was close.
I think most people that were unaware of what they do were literally blown away by the care and the attention to detail that VitalOne does.
As a medical director, I think I have a very unique perspective on evaluating VitalOne. And I have to say, I was really impressed. It is completely seamless. They were on top of absolutely everything. They make it look easy, and it's definitely not. I got settled in, and just as I was finishing up all of that, in walks a team member from VitalOne with a hot meal, courtesy of Isaac.
So many of the days that we get a phone call from Isaac from VitalOne, we know he doesn't just want food, but he always wants the highest, best quality food for his clients. But not just that. He doesn't just want to make his clients happy, he wants to make everybody around happy also. That means his crew and everybody involved.
It was a gesture on his behalf to say, hey, here's some good food, try this, we want you to eat. And so that was completely unexpected. Absolutely fantastic service. This was all orchestrated and taken care of financially by insurance. I didn't have to worry about a thing. I'm back on the other side now where I'm meant to be. Thanks for the help to VitalOne.